I'm excited to speak with Dr. Marilyn Heine about The Pitt, the HBO Max medical drama set in Pittsburgh. The show has garnered praise for its realism and thoughtful portrayal of emergency medicine, and Dr. Heine's perspective as a physician leader and advocate offers valuable insight into how accurate storytelling can influence public understanding of healthcare and elevate the voices of medical professionals. Dr. Marilyn Heine is a champion for physicians, patients, public health, and the patient-physician relationship. She is an emergency medicine and hematology-oncology physician who has spent her career on the front lines of patient care while advocating for healthcare policies to help physicians and patients. She served as the 162nd PAMED President and president of Bucks County Medical Society, and was elected to the AMA Board of Trustees in 2022. Thank you for joining me, Dr. Heine.
My pleasure. Thank you so much for the opportunity to share with you some thoughts on the pit and, as you said, the impact of media and intersection with medicine.
Yeah, of course. This past September was the American College for Emergency Physicians 2025 conference in Salt Lake City, Utah, and you attended, correct?
Yes, I did. I was honored to be there.
Can you tell me a little bit about what stood out to you the most in this year's assembly?
Yeah, so highlights from ASEP 25 included seeing wonderful friends and colleagues from across the country, which is always such a joy and really uplifting experience. I also was honored to serve as faculty for the Scientific Assembly and participated as part of our state chapter for emergency physicians in the policy forming council that preceded the actual Scientific Assembly. I was also deeply honored to receive the American College of Emergency Physicians James D. Mills Award for outstanding contribution to emergency medicine.
Congratulations. That's a big
Thank
deal.
you. Thank you.
What were some of the most impactful sessions or discussions you attended during the scientific assembly?
The opening session was especially impactful. We got to hear from Olympic gold medalist Scott Hamilton, who shared his inspiring journey of resilience, overcoming childhood illness and two cancers. He offered a powerful message of perseverance, hope, and turning obstacles into opportunities. This was followed by a dynamic panel discussion with the Pitt star Noah Wiley, writer, producer, and emergency physician, Dr. Joe Sachs, and emergency physician and show medical advisor, Dr. Mel Herbert. This was moderated by our incoming ASEP president, Dr. Tony Cirillo.
What was your reaction to the panel featuring Noah Wiley and Joe Sachs?
The panel provided an inside look to how they capture the chaos, intensity, and humanity of the emergency department with stunning realism. We learned about the meticulous attention to detail that goes into set construction, creating convincing prosthetics and props, and authenticity of storylines to convey complex human experiences. We heard about the numerous emergency medical technical advisors and others who engage to get every detail right, from terminology to procedures and trauma choreography. These features enable the show to deeply resonate and rekindle purpose with emergency physicians across the country.
How did the panel address the emotional toll of emergency medicine on healthcare professionals?
The panel recognizes the emotional toll of emergency medicine, and the panel, those key members of the pit, really show their commitment to emphasize this in the show. So the show includes time for the team to pause after a loss, as well as recognizing the demands to then keep on moving forward. It's a really incredible dynamic that the pit demonstrates the teamwork that goes into emergency medicine, as well as the precious relationships, patient-physician relationships that can form along the way.
What was the tone of the conversation of the panel? Was it more reflective, educational, or inspirational?
It was actually all three. The conversation was at times reflective, noting the efforts in the show to bring out the deep consideration of experiences, emotions, and the meaning behind events, such as when Dr. Robbie, who, as you know, is Noah Wiley's character, has PTSD from caring for patients during the COVID pandemic and losing a beloved mentor. This resonated with those of us who worked through the pandemic and risked having COVID ourselves due to our exposures, despite our precautions, and also the risk of bringing it home to our loved ones. It was also educational with many behind the scenes views and a plethora of information. They showed a video that showed many of the key areas of the prosthetics and props that they use to make it seem real, and also the set design and all of the detail that went into that. It was also inspirational as the panelists expressed appreciation for emergency physicians and the other care team members and a sense of solidarity that was so important in the show as well as to those of us who watch it.
That's really so. You talked earlier about how the pit conveyed the reality of the pandemic in the emergency department. What other aspects of the show reflect the realities of working in emergency medicine?
Yeah, so The Pit overall is scripted television that tells deeply human stories that double as public health education. And these stories range across the diversity of types of cases that of patients who present. We see so many different types of patients, and some may seem that they have a higher acuity than others, and some are more of a social reason for being there. In the initial episode, a mother presents, she had self actually induced vomiting so that she could get to the emergency department because she was mostly concerned about her son with a mental health issue. And we see so many young people in the emergency department who have mental health concerns. It highlights the pace, the patient stories, and the complex human experiences, both of the patients as well as for those who provide their care. And in the pit, we see Dr. Robbie's and others' integrity, their love for the profession, care for fellow medical professionals, but also the weariness of being an emergency physician and our broken healthcare system and the trauma that still lives on in so many in the medical field from the pandemic.
Definitely. How do you think shows like The Pit influence public understanding of emergency medicine?
By showing the human side and the clinical aspects, the public may gain some understanding of the dynamics of what happens in an emergency department. This is really helpful for patients when they come in because they may see what looks like chaos, although it's orchestrated. It's really important to understand that what actually happens and the needs of the emergency physicians, for example, to focus on multiple patients, but prioritizing them based on their acuity, the importance of working as a team, and the causes of the increasing emergency department boarding and crowding that are really driven by health system wide issues. So, unfortunately, the patients may be cared for in the hallway or in the waiting room because there isn't a bed upstairs to which to transfer them if they need admission. And it impacts everyone, both the emotional toll as well as the challenges of caring for patients, sharing to be able to have privacy provided for them, but also to be able to care for them in a way that addresses their acute medical need.
Yeah. Did any scene or storyline resonate with your own experiences in emergency medicine?
I would say several did, but one that really stands out that I thought was particularly beautifully done was a scene that was an 80-year-old Black male patient who was admitted after loss of consciousness, and the team was surprised by his familiarity with medical procedures. He had a pacemaker that wasn't functioning well, but despite his years, he understood really much of what was going on when they were caring for him medically. And the team then learned that this patient was once a medic for the Freedom House Ambulance Service, a forerunner of our EMS. And it underscores how each patient has a story beyond what brings them to the emergency department. They have fears that bring them in, and sometimes those need to be addressed. They also have a background that really helps to enlighten what their experience is and inform them. And sometimes we have those moments when we get to learn more from our patients, more about who they are, what their background is, and that can be especially rewarding.
That was a really great scene, and I was glad they included it. Moving on to advocacy and storytelling. Do you think the storytelling as we see in the pit can be used to advance public health education?
Yeah, the patient stories help to inform viewers about certain public health and safety issues. The public and their understanding of the realities of the emergency department can be really helpful. They understand better, hopefully, about the critical role of emergency medicine, the critical role of the safety net that it provides for patients, and the emergency physicians who provide the care, as well as other members of the team. Those issues, there are certain public health issues, as you've mentioned, that can be exemplified and are done so in several episodes that bring forth several issues on this area.
Do you see a potential for shows like The Pit to influence health policy?
Yeah, I think that it's really important for others to understand the critical role of the safety net. So, for example, Dr. Joe Sachs, who had said in a time when cuts to Medicaid and Medicare threaten that safety net, we need the public to understand what's at stake. And one of the biggest challenges in emergency medicine is emergency department boarding, particularly for mental health. And the show emphasizes causes of ED boarding and crowding that are actually driven by health system-wide issues. Hopefully, that will motivate policymakers who watch the show, as well as patients who are in the public, to understand A, why there's boarding and crowding, and steps that they can take to hopefully address it in a meaningful way.
Yes, agree. How does The Pit compare to past medical dramas like ER in terms of realism and emotional depth?
Yeah, so unlike the fast-paced, idealized drama of ER, The Pit presents a more raw and contemporary view of a United States emergency department, and it's been described as gritty, chaotic, and honest. It portrays well the boarding crisis, including the emotional drain on the patients and those who provide their care, the pressure of what we call waiting room medicine for those who are unable to actually come back but still need care in the waiting room area, and the wide spectrum of types of patients who present. So the scenarios mirror everyday challenges for physicians and patients, which hopefully will allow those who are outside of emergency medicine, both patients and colleagues who do not work in the ED, to have a better understanding of the dynamics, the pressures, and the throughput pressures on those who are in the emergency department.
Along those lines, with the realism that is a part of The Pit, do you think that it could be used as a learning tool for residents or just entertainment?
Oh, it's absolutely educational. The educational aspects are quite valuable for both medical students and residents on a professional and a personal level. I think those who are in medical school who haven't yet chosen a residency will understand what it means to be in emergency medicine, and residents from all specialties, not just emergency medicine, have a better understanding of what it means to work in the ED, the types of patients, the acuity, the throughput flow issues that we talk about, as well as the social underpinning elements that may bring patients and their family members into the emergency department. Having that broad understanding is very important as an educational opportunity.
That's a great answer. Thank you. Um, Along the lines of that question, has a patient or have you heard of a patient ever referencing a medical drama like the Pit or ER during a visit?
Yes, I remember a patient saying, this is some certain patients have said this is somewhat like we see on TV. And there are others who say, oh, it's a bit different because obviously television is not exactly reality. But I think that the Pit, certainly more than ER, does a superb job of giving insight into what one can anticipate coming to the emergency department and hopefully what is going on there. And sometimes the patients do comment on that.
How do you respond when pop culture intersects with clinical care?
So pop culture can be super helpful in informing the public and policymakers, and they understand perhaps more about what's going on in the emergency department, in particular with this show. The authenticity provides insight to the public, and when it's in pop culture, it's more relatable to others, and so they have a better appreciation of what's going on the clinical side sometimes, and certainly the dynamics that affect what happens. And so, as they're better informed, when it comes time to develop policy or advance legislation or regulation regarding the emergency department, shows such as the Pitt in particular, that really is committed to providing a realistic view, can be very helpful because many people may have seen perhaps just an episode, or they've heard about it, or they've watched the whole series, and they have a much deeper appreciation of what the challenges are. And then when someone comes forward from emergency medicine, for example, with solutions that can be advanced or piloted to see if they help, they're much more receptive to that.
In a similar vein, what role do you think media should play in shaping the narrative around physician well-being and burnout, especially as it pertains to emergency medicine physicians?
Yeah, so with regard to the media could play with regard to physician well-being and burnout, we know that the Noah Wiley, Joe Sachs, Mel Herbert, they're all super dedicated to making sure that others understand the stressors that are on emergency physicians while caring for patients. And it was really telling that within days of the panel, Noah Wiley, who won an Emmy for Outstanding Lead Actor in a drama series, and in his acceptance speech, he dedicated the award to real life healthcare workers. He wrote to anybody who's going on shift tonight, who is coming off shift tonight, this one is for you. And that really resonated because we all felt that we understood that to him it was so important to make sure that well-being was recognized. Also, Dr. Sachs had said, we're not just educating the public, we're educating physicians too, reminding them that they're not alone in their experiences.
Does it feel strange to have a non-doctor advocating on behalf of emergency medicine physicians? And what are the benefits of it?
Yeah, so having a non-doctor such as the relatable Dr. Robbie, who's really human, super intelligent, and able to engage with the teams very effectively and care for patients with expertise, when he actually in real life, Noah Wiley, advocates for emergency physicians and emergency medicine, this reinforces the credibility of our messages because he's relatable and because people understand what's going on better because of the excellent performances that take place on the Pit. So in the Pit, the expert director and consultants, their commitment to portray scenes and emotions with realism inform the show. And Noah Wiley, in fact, has advocated for physician wellness off the set as well. So it does help a lot when you have that star power that's behind your messages and people have a better understanding of the issues. Having someone such as Noah Wiley doing that, the messages are heard, perhaps even more so than coming from others. And it complements well those of us who are involved in advocacy when we send our messages forward because they may have heard it from someone such as Noah Wiley or others who are champions in that area.
How can emergency physicians stay engaged in shaping healthcare policy at the state and national levels?
Now, emergency physicians can help shape health policy at the state and national levels by several measures. First, you can become a member, if you're not already, in organized medicine, and we can go into those organizations in just a second. But especially being an engaged member, that's even more helpful. And organizations in which you can be a member are the Pennsylvania College of Emergency Physicians, the Pennsylvania Medical Society, including its House of Delegates, the American College of Emergency Physicians, including its policy forming council, the American Medical Association, including the policy forming House of Delegates. So there are a variety of ways. Being a member is really important, but if you want to have your voice specifically heard, those are channels in which to do so at an even higher level than being a member. But certainly being a member is greatly appreciated. One can also attend the American College of Emergency Physicians Leadership and Advocacy Conference and the American Medical Association National Advocacy Conference and actually advocate on Capitol Hill in DC on certain issues that are of highest importance to emergency medicine or medicine in general. You can host a lawmaker at your emergency department. There are certain steps to help make that happen, and the American College of Emergency Physicians has certain tips and a sheet that goes over the steps to take in order to make that happen successfully. Because you would need to coordinate it usually with your hospital administration. And of greatest importance, though, overall, is the value, the incredible value of developing relationships with your state and federal legislators to help be a resource for them and advance key issues for the profession.
Thank you so much for your insight in joining us today, Dr. Heine. I'm sure that doctors and non-doctors alike will really value the connections you've made between the show and real life. I appreciate it.
Absolutely, a pleasure.